Hello, I'm Dr. Diane Webster, and this story is called Giving and Receiving Gifts. It's set in 1993, Fortitude Valley, Brisbane, where Dr. Alice, the eye surgeon, is helping her patients to see better. Dr. Alice gives a lot of gifts to her patients when she improves their sights or prevents them from going blind, but she receives many presents in return, and not only the physical kind, as you'll see in this story. Let's get started. Eric's cataract surgery had gone well. He was out in the post-op recovery area between cases, and I went over to talk to him. He is a returned World War II veteran, now 80 years old. Your surgery has gone well, Eric. Where are you staying tonight in Brisbane? The repat has put me up at a boarding house in Fortitude Valley, but I'm worried about getting to the toilet tonight. I'll have to go out into the cold. The toilet is down the back stairs outside. My room's on the first floor. It's just an old Queenslander, he answered me. I knew the kind of place he was describing. There were still a number of these old, run-down boarding houses left in Brisbane in the early 90s. At the end of the operating list, my husband Tim and I were driving home together from our day surgery and ophthalmology practice in central Fortitude Valley, Brisbane. We lived about 20 minutes by car away in the leafy suburb of Ashgrove. We hadn't gone far when I remembered my conversation with Eric about getting up to the toilet in the middle of the night and possibly falling down the back stairs. I imagined him injuring himself and destroying the beautiful cataract surgery I had done earlier today. Pull over, Tim. We need to go back and pick up Eric Wright. He's staying in some broken-down boarding house tonight in the valley. He can't stay there. He might injure himself tonight going down the back stairs to the toilet. He's probably still has some sedation working after his surgery, and his balance is poor at the best of times. Let's pick him up and take him back to our place to stay the night. I can take him into the practice tomorrow morning for his post-op check, and then we can ring repat for a car to take him back home to Byron Bay. This is the first time I had ever hosted a patient at my own home for the night after their cataract surgery. Am I crossing professional boundaries here? I thought. But poor Eric, there was no one at home to look after him. I first met Eric 5 years earlier in 1988 when he came to see me as a patient. I was working in the glaucoma clinic at the Repatriation Hospital Greenslopes. He was in a bad way, having lost much of the sight in each eye from glaucoma. His eye pressures were very high, and without immediate surgery, he would likely lose the sight completely in each eye within a few weeks. Medication in the form of eye drops had not worked, and laser treatment had been tried by another ophthalmologist closer to his home in rural New South Wales, to no avail. Eric had been referred by that doctor to the specialist glaucoma unit here at Greenslopes Hospital, Queensland, of which I was the director. Eric was admitted to the hospital, and I operated on his first eye successfully, and then the second eye 5 days later, once we knew the first eye was stable. I think, looking back, the reason we connected, Eric and I, at that time, patient and doctor, was our shared loss. I was 32 years old and only recently lost my baby daughter, Rebecca, to stillbirth. I found going to work and caring for others a godsend, as it took my mind off thinking about what I had lost. Eric was 75 years old, and he had recently lost his darling wife of nearly 50 years to cancer. Every time Eric would come back for his glaucoma review appointments, he would tell me how he was coping with his pain and loss, and it helped me to cope with mine. I never told him, of course, about the loss of my own daughter, as that would have been unprofessional. Despite this, hearing about how he was coping with his own emotional pain and loss really helped me cope better with mine. Well, at least it took my mind off it. "How are you spending your days?" I would ask him. "Every morning I take a long walk on the beach and watch the sunrise. I take photographs of the sunrise and I'll bring some for you next time. I love my rock collection and I have catalogued it and put the rocks in a showcase in my lounge room. My Banksias keep me busy. I have them in the greenhouse and I can take some photos for you as well." I could tell that it was a gift I was giving him, asking him about his life, and he was so grateful to be able to tell someone who cared all about it. I could see his face light up as he told me. So that's how it started. Every visit to the glaucoma clinic, Eric would bring me photos of his sunrises in Byron Bay and photos of his Banksias and his rocks. Each visit we would marvel that he could still see and had some sight in his eyes. His eye pressures were in the normal range and he could see to take his photos and care for his Banksias. When I started my own private practice in Fortitude Valley in 1989, Eric would come for his visits there and bring more photos. Then he developed cataracts and needed operating. And that's what brought him to be staying at my home for his post-op night after his surgery. I felt relieved to have him safe and sound at my place. I had invested a lot in Eric, both professionally and personally, not only with his friendship, but 4 surgeries in total to both eyes eventually. 1 glaucoma surgery each eye and 1 cataract extraction each eye. All successful and paid for by the repatriation department of the Australian government. The repatriation department, or REPAT as we called it, was a wonderful service provided by the government for our returned veterans who had been in active service overseas during the Second World War. Following Eric's successful cataract surgery on his second eye, I received a parcel in the mail. I opened the packet with hesitancy as I knew it was from Eric and I couldn't think why in the world he would be sending me a parcel from Byron Bay. Inside it was a beautiful jade necklace which he had obviously paid a fortune for. Now this was going too far, I thought. I couldn't accept such a gift from a patient. It was unethical, I was sure. So without too much hesitation, I posted it back to him, saying I couldn't accept it for professional reasons. Well, that was a disaster. He was not only crestfallen, but actually heartbroken that I would not accept it and that I had sent it back to him. A month later, he came to see me for his scheduled glaucoma visit. Sitting in the patient chair, he was nearly crying and saying how much it would mean to him if I would reconsider and accept it. He then promptly produced the necklace out of his bag and placed it in its beautiful case on my desk in my office and insisted that I keep it. I didn't have the heart to refuse it then, as I could see it meant so much to him. So much for professional standards and boundaries. Sometimes I thought, you just need to graciously accept the gift from the patient, which obviously gives them so much joy in the giving. Eric and I were now firm friends, and my husband Tim and I decided at Easter in 1995 to drive to Byron Bay and stay for a few days in a small guest house, along with our sons, now aged 3 and 5. We went over to Eric's house one day, and he was thrilled to see us. Before we left, he insisted I accept many more beautiful pieces from his rock collection and take them home with me. The gifts just kept on coming, it seems. He was getting very frail now, and I felt lucky to see his greenhouse and his Banksias for real, not just in the photos. I wondered how much longer he would be around, and I wanted him to feel joy every day for as long as possible. When Eric passed away in 2000, at the age of 87, one of his daughters sent me a heartfelt letter of thanks for looking after Eric and his eyesight. She told me how his visits to see me was such a highlight for him. She said he had functional sight to the very end and was able to continue his photography, his early morning walks, and caring for his flowers. I was relieved his sight had lasted until the very end, because that is the goal for a glaucoma and cataract surgeon, to preserve our patient's sight until they finally pass away. I learned from Eric to appreciate the ordinary, routine things every day, to be grateful to be able to take a leisurely walk, to see the sunrise, to marvel at the rock collection and appreciate the beauty of the Banksias. I don't want to forget Eric and the gifts he gave me, the gifts we gave each other. That's the end of the story. A collection of my short stories with the title 4 Ways to Die at Riverside Towers is available now on Amazon and Kindle, or you can listen to my other stories anytime on my YouTube channel at Dr. Diane Leslie Webster and subscribe to get notice of more stories. It's free. I hope you have a great day today doing something that you love with someone that you love.